Hey, anatomy students. Today we start the first day of the respiratory system. So we'll be learning the anatomy of this system and the physiology, obviously, and talk about some diseases involving this system. We've gotten a preview of the system already. We mentioned a little bit about the lungs when we did the cardiovascular system, and then obviously with the COVID-19 and its infection of cells in the lungs. We have talked about that also. Today, we'll focus on anatomy. But big overview first, some words you should know. Respiration. A lot of people think respiration is breathing, when in fact it is not breathing. It is the exchange of gas. And in this case, oxygen into our bodies and carbon dioxide out. That exchange happens in the lungs and at every capillary bed, tissue, and organ. The word for breathing, not respiration, it's pulmonary ventilation. And we know through prior knowledge that there are two parts to pulmonary ventilation: inspiration to breathe in, and expiration to breathe out. Here is an outline of all of the organs we want to cover today. We'll have separate slides for each of these, so let's get right into it with the nose and the nasal cavity. The external nose, we already know, is made of cartilage, and the bone, the nasal bone, supports that. The external nares would be the official name for our nostrils, those two holes that allow air into our nasal cavity. The internal nose would house the internal nares, which would just be a continuation of those openings from the outside environment into our nasal cavity. The function overall of our nose is to warm, moisten, and filter air. So yes, if you're thinking the same question I'm thinking, it is better to breathe through your nose than it is through your mouth. Because the air is, these three things are more efficiently done through the nose. We also smell, have some olfactory nerves attached to our nasal cavity, and it does help us speak. And you may have done that thing where you plug your nose and try to talk like I am right now, and it really impacts how you can talk. So your nasal cavity, your nose, does help you with your speech. The nasal cavity itself, remember, the vestibule is a bone that is found in our nasal cavity. It's also, remember, our nose is two separate, our nasal cavity is two separate parts. The nasal septum divides vertically right through the middle of the nasal cavity. So really our right nair and our left nair work independently of one another. And so you may have had times in your life where you had one plugged up and the other one not plugged up. That certainly has happened to me a lot in my life. And it's not fun to have one open and one closed. We also have hairs in our nasal cavity, which would hold mucus to allow us to filter what we breathe in through our nose. This picture shows a deviated septum. You may have heard of a deviated septum. Some people are born with them. Some people get punched in the nose or hit in the nose, and it causes a deviated septum. In almost all cases, you have to have a rhinoplasty surgery, which would be a surgery to straighten out the nasal septum. So some of you may have had this done, or you may know your parents who have had this done, because when your septum is deviated, it's more difficult to efficiently breathe through your nose. If you go all the way back to the skeletal system, we have conchae inside our nose. These are little protrusions from the walls of our nasal cavity, which will help with the flow of air. It also increases the amount of mucus that can be held in the area. So I already mentioned air turbulence, and there are some smell epitheliums in the upper portion of the conchae lining. This is a picture. I think this demonstrates it better. You can see the conchae inside our nasal cavity, which help move the air through our nasal cavity. Remember, the external nair is the actual opening, and the internal nair would be the inside opening. There are sinuses that surround this also, and we'll talk about sinuses eventually in this unit, that help produce the mucus that will go into the nasal cavity. Pharynx is the next part. So we're just going in order on how air travels from out to in. So we go from the nose, the nasal cavity, to the pharynx. Remember, the pharynx is the special name for the throat, passageway for the internal nares into the larynx. We know there are three regions, a naso, an oro, and a laryngopharynx, and these three parts are mostly made of skeletal muscle with an epithelial lining. Function is just a passageway for food and air, and it also would help resonate sound. And here's a picture showing the three parts. The nasopharynx is superior, oropharynx is in the middle from the mouth, and the laryngopharynx is the most inferior part, which would have the epiglottis in it, which is the structure that closes the trachea when you swallow. But when you're not swallowing, the epiglottis is always keeping the trachea open, the windpipe, to allow us to breathe. Larynx, also known as the voice box, connects the laryngopharynx to the trachea, has 9 pieces of cartilage, has the thyroid cartilage and the cricoid cartilage. So 2 different pieces of cartilage. The thyroid cartilage is superior, the cricoid cartilage is inferior. Also would house the vocal folds, which would have the vocal cords in them. This is why it's called the voice box, because the larynx is what allows us to produce that sound. And then we already talked about the epiglottis. That leads into the trachea, also known as the windpipe. And it's a passageway. It's about 12 centimeters in length, has about 2.5 centimeters of diameter. Remember, it is made of cartilage also. And it's the pathway into the right and left primary bronchi. The bronchi, sometimes called bronchial tubes. We'll call them bronchi. There are several different types of bronchi. So these are just pathway to the alveoli. The alveoli are the grape-like sacs, air sacs. We have millions of those in our lungs. And here's the order. It goes, the trachea is the biggest in diameter, and that branches into the primary bronchi, which branch into the secondary bronchi, which are a little bit smaller in diameter, which branch into the tertiary bronchi, which are the smallest bronchi. And then that will branch into the bronchioles, which then leads into the alveoli. And this is just a picture of that, showing, first of all, that human lungs have 5 lobes, 3 on the right side and 2 on the left side. And you can see the trachea in the middle would immediately branch into primary bronchi, and then secondary bronchi would be a little bit smaller. Tertiary, the smallest, and then you can't really see alveoli in this picture, but there would be millions of little air sacs attached to the tertiary bronchi. The lungs themselves, cone-shaped, conical, shaped in the thoracic cavity. That's the cavity of the chest. The heart and mediastinum. So they are not one and the same. They're in separate cavities. If you remember back, the heart is in the pericardial cavity. There are some membranes that surround our lungs. They're called pleural membranes. And there are 2. The parietal pleura would line the wall of the thoracic cavity. So this would be like on the inside of your rib cage, which there would be it's almost a clear lining on the inside of your rib cage. And then the visceral pleura would be the opaque connective tissue lining of our lungs themselves. And then there's a space between the 2, and that's called the pleural space. And these are all important to function of the lungs. Let's finish with how we breathe next. Pulmonary ventilation, remember, is breathing. And there are 2 phases: inspiration, in, expiration, gases out. And the main reason we can breathe here on Earth, remember, is yes, there's 20-some% oxygen in the air, which is critical, but our main thing is atmospheric pressure. The pressure of air on top of us allows us to breathe. And the closer you are to sea level on Earth, the more you get to 760 millimeters of mercury of air at sea level. We're about 2 football fields above sea level where we are right now in Yorktown or Muncie. But so that means we don't have as much air on top of us. We're probably 758, 757 millimeters of mercury, but that's certainly more than enough to be able to change the pressure inside our lungs to bring air in as well as to take air out. Obviously, it gets very difficult to breathe the higher up on Earth you go. So Trying to climb Mount Everest is difficult because there's not as much air pressure. Um, Airplanes that fly at 60,000 feet, if they lose cabin pressure, it's going to be very difficult to breathe if an airplane loses cabin pressure because there's just not enough air pressure at that high of an elevation. Mechanics of breathing. Intrapulmonary pressure is the pressure on the alveoli, and this changes every time you breathe in and out, and it always equalizes with the atmospheric pressure. Intrapleural pressure is the pressure in the pleural cavity. This also fluctuates every time you breathe, and it will always be a negative pressure. Boyle's law is critical to this. Boyle's law is a law on Earth. You who have taken chemistry know about Boyle's law, and it's an inverse relationship on Earth. As air pressure increases, air volume decreases, and vice versa. So if air pressure goes up, volume goes down, in the lungs goes down. If air pressure goes down, volume goes up in the lungs. And really, by Boyle's law, this is the way we are able to breathe on Earth. So let's get into the steps of breathing. Inspiration, inspiratory muscles contract. So the prime mover of breathing, remember, is the diaphragm. And then the external intercostal muscles would also help with this movement, the inspiratory muscle movement. So as soon as those muscles contract, remember the diaphragm is right underneath your rib cage, the thoracic volume increases. So the volume of your chest cavity gets higher. The lungs stretch and intrapulmonary volume increases. So remember, volume's going up. That means by Boyle's law, the pressure inside your lungs will go down, lower than the air pressure in the room that you're currently sitting in. So let's say, just for the heck of it, it's 760 out here in the air in our room, and then we take our diaphragm contracts, and that brings inside our lungs maybe to like 756 millimeters of mercury, 757. So by the law of gradients, things move from high to low. So air will move from high pressure to low pressure. Air will move from the outside air into your lungs. And that's inspiration. Expiration is the exact opposite. So your diaphragm relaxes. Your external intercostal muscles relax. And that decreases the volume inside your thoracic cavity. Your lungs recoil. That means they get smaller. The volume decreases, and because the volume decreases, that means the pressure increases. So now let's say that inside your lungs it's like 763, 764, but out in in your room right now it's 760. So by the gradient rules, air has to flow from high to low. That means that air has to flow from the higher pressure inside your lungs to the lower pressure out in the external environment. So air will flow out. And so really the exact opposite happens every time we breathe in and every time we breathe out. Most people, I believe, breathe 10 or less times per minute, really. Just depends on your current mood, depends on if you're resting or if you're doing some exercise, obviously. And that concludes our first presentation of the respiratory system. This picture just shows kind of everything I just talked about in terms of breathing in, inspiration, and breathing out, expiration. Now I'm going to have you do an activity to label the anatomy of the respiratory system. Talk to you all later.